Good morning, Dr. Goles. I'm super excited to have you on the podcast. We've been trying to plan this date for a while, so now here we are. So welcome.
Thank you, Brittany. Yeah, I appreciate being on the call with you and in this podcast and being being able to provide some information to your wonderful audience.
Absolutely. So let's start off by having you share a little bit with the audience about who you are, what you do, how you got into the airway space.
Yeah, absolutely. So yeah, I'm technically a dentist, even though I do all sleep and airway treatments now. I'm not. I was actually in the army for a while, and I'd always kind of joke that that with the soldiers that I wasn't a real doctor or a real soldier. I was just a dentist, so don't ask me any questions. But now I'm like, now I'm not even a real dentist, so now let's go with that. Yeah, so I have my own practice in Colorado Springs, Colorado, about an hour south of Denver, where all I focus on is sleep and airway treatments from kids as young as 3 to adults as old as 80, and that's all I focus on, and it's obviously been extremely rewarding and in many aspects, and it's easy to become passionate about this kind of work, especially when you start to see the massive change that you can make in people's lives, and I never thought I could make this big of an impact on people's lives as well. And that's kind of where then, yeah, it's easy to everything kind of continues to snowball from there with I guess this kind of a field. And I guess initially kind of got into this field because I did a residency through the military, and I kind of did all of my research on sleep apnea appliances for the adults, because it was kind of the alternative to CPAP. And from there is why I guess that kind of gave me my foundation. I had a lot of background in orthodontics, just because I was trained under James McNamara at University of Michigan, where I went to dental school. And then I did a bunch of ortho in my residency as well. So I kind of had both of those already foundation that was there. And then when some of these other newer techniques and newer technologies kind of came on my lap, it kind of became like a no-brainer. And McNamara's name was actually all over some of the adult stuff that I do. And that's kind of where I actually started to really dive into it, because what we do, we're kind of taught that we can't do it. And so it is kind of fun to be able to kind of blaze the trail with that. So we do a lot of expansion type treatments for adults and kids to give them a bigger airway, because as I think probably people that are listening to this podcast know that your jawbones are the scaffolding to your airway. Your airway is the tube that goes down your throat that's surrounded by a bunch of soft tissue, and that soft tissue is supported by your jawbone. So if your jaws are narrow and held back, you're going to be breathing more out of a coffee straw instead of a garden hose, is kind of the term I always like to use. And you're going to have less space for your tongues. Your tongues will get more likely to get pushed back into the airway. And then you don't have space for your teeth as well, so they become crowded. You need to have braces. You don't have space for your wisdom teeth, so they become impacted. And we have to then address those. And so, ideally, we want to have enough space for all of our teeth, including our wisdom teeth. And so we do that for adults and kids, from 3 all the way up to 80. And excuse me, that's kind of our big aspect. But obviously, the other half of our equation that we deal with every single patient is the myofunctional therapy aspect, because the reason why those bones, as you know, that why they aren't big enough and they're not developing like they're supposed to be, is because the muscles aren't working like they're supposed to be. Because form of the bone follows function of the muscle, and so that is we're fixing what the muscles didn't do, but then we have to fix the muscles to be able to maintain it.
Now, as far as your adult patients go, what type of, are you doing expansion appliances like removable devices or?
Yeah, yep. So it's all removable. So in order for it to be fixed, it typically needs to be something surgically involved.
Mhm.
And that's kind of where the magic behind some of this treatment is that it's a removable appliance for these adults, and we can do it all non-surgically. We can get some pretty significant expansion of the midface, of the roof of the mouth, of the nose, the sinuses, where we can drain that. And it's not just from what we've seen with our patients, but myself as well. As my own first patient, I was actually 28 years old. I was top 5% of the world in Ironman triathletes when I got diagnosed with moderate sleep apnea. And I'm like, what are you, what are you
Wow.
talking about? Right. And the only
Yeah.
time I had that is I would clench and grind my teeth. So I was my own first patient through these removable expansion appliances that are out there. We focus in a lot of these Vivos appliances, and I've done the most of those in the company for the adult cases. So I've done thousands of those and been able to see the magic that can do. And so I went through that myself, and one of the biggest things I could tell is I could breathe through my nose so much better.
Mm.
And so granted, getting over the end of a little bit of a sniffles that my kids gave me, with the holiday season. But for the most part, I mean, my nose is wide open, and that's one of the biggest things that I noticed. And through that expansion and that process, my apnea went from 24 episodes an hour down to between 1 to 3 on any given night.
Wow, that's incredible.
Yeah, so it was my own first success story.
Yeah, that's incredible. Now, let me ask you this, because a lot of, and I'm sure you get this all the time from other dentists, but dentists that, practices that want to get into airway, but they don't really know how to start the conversation because they kind of feel like, I've been seeing these patients for sometimes generations, these families, and all of a sudden now I'm noticing X, Y, and Z. So like, how do you recommend that they kind of start those honest conversations?
Yeah, that's a great question because doing sleep, it's a whole different sleep and airways, almost a different thought process than what we're doing as dentists. Dentists, like everything is black and white. I cut this tooth, I put the crown margin here. It's very like, I mean, our OCD tendencies, type A tendencies, this feeds great into those kinds of personalities. And that's what
Yep.
most of us dentists are.
And hygienists.
Yeah. And then this is a lot more gray. It's almost kind of more like it is kind of feeling like it's practicing medicine. It's a lot more, there's a lot more moving parts to it, and it's not so black and white. And then being able to get off of that and then start to talk to our patients about, okay, here, well, like the crazy thing is that, so I work a lot with functional medicine doctors as well that are working to root cause issues when it comes to health and adrenals, toxins, leaky gut problems that most of us have these issues with. Dentistry is kind of like what I guess one of my infamous quotes that I like to tell people is what dentistry is to airway is kind of what allopathic medicine is to functional medicine, right? So a lot of things that we fix as dentists can be prevented or fixed by fixing the airway and the sleep aspect. Okay, when we look at abfraction lesions, recession, cracked teeth, cavities from mouth breathing, I mean, all these things are usually a downstream effect of what we fix as with sleep and airway. And so with that being said, though, we like, it's only still very slightly getting into the mainstream education, and barely even if with that. I was at Michigan earlier this year, and they just now have started to do some dental sleep medicine, and it's very, very basic, and it's mandibular advancement devices pretty much, and very traditional. And so there's still not a lot there. And so I think a good way that a doctor can talk to a patient is that this is coming on into our field like by storm, and we have to realize that we're not just going to be treating the downstream effects and like, okay, why are your teeth keep breaking? Why do I have to keep doing crowns? Why do you have crowns on all your molars? Why do you keep having cavities? Why is this recession not improving? Why did we do a gum graft and that not take? There's so many things that now that it's kind of like when you start to word it the right way of, we're starting to learn a lot more about this. And thankfully the research is now being able to back it up. We've had publications about it. And yes, you've been around here for 20, 30, 40 years, but this field is drastically progressing, and it's taken a lot of the dentists to really progress the field of airway and sleep. And I'm now a part of it. And now as we look at this is something to be able to maximize not just your dental health, but your overall quality of life from improving sleep. This is now where the angle that I'm starting to take is how I would start to talk to patients if they've been around for decades in your practice.
Right. And I think they appreciate that because then they know they're not just like a patient in the chair. Like you literally are caring about their entire body from head to toe and how these airway issues are impacting like every system of our body. I think another question that, or conversation that practices struggle with is maybe they have the the dentist's role down, like they're recommending expansion appliances, myofunctional guidance appliances, sleep appliances, whatever the case may be. But you mentioned that other very important aspect of myofunctional therapy. And I hear from a lot of doctors like, we have all these patients in treatment, but I just don't know how to get them to see the value in paying another whatever, $1,500, for myofunctional therapy. So from the dentist point of view, like how do you relate the importance of that and the value to your patients that are already going through treatment?
Great question. Yeah, with that. And with it being half of the equation and being the reason why I have to go through this expansion in the first place, I don't really give them an option.
That's what I always say to people. Like, why are you giving them an option? Like, what, your work's going to fail if they don't do the myofunctional therapy.
Correct. And I hang my hat. The reason why I have such a reputation that I do with sleep and airway is because of the results that we create, right?
Mhm.
And even some of the published studies that they did with the adults, where with this expansion appliances that we have, 89% of our patients, we have a reduction in their AHI. Granted, that's only one piece of the puzzle, and then 65% of our patients had at least a 50% reduction in their sleep apnea. Then about a third had a full resolution of sleep apnea. That's just from these expansion appliances. But when you add myofunctional therapy on top of it, you have an additional 55% improvement in their sleep apnea. And that's been actually published with some of our data as well. And so it is a huge part of this equation. And that's what also helps with the maintenance of it, right? It's so easy to tell somebody, especially if they've gone through it themselves. Okay, when you had braces, what did you have to do afterwards, right? And what did you have to do for the rest of your life? And you had to wear a retainer. And if you didn't, everything would relapse. And then all of us know somebody who's gone through braces 2, 3, 4 times, or they've been in braces for like 7 or 8 years because you're working against the muscles. You're
Right.
swimming upstream, right?
Mhm.
And so when I talk to that with our patients, and not only is it going to be a really important part with the stability of the expansion, we want to make sure that the tongue is winning the war against the lips and cheeks that are pulling everything inwards, right? And so not only do we want to have that to stabilize our expansion to have that continuous benefit effect, but as you train those muscles to be like stronger and functioning properly, that's going to further help maintain that airway when you sleep, right? And so when I talk to a patient or anybody in general, what we're trying to do is maximize sleep quality. And if you have to make sure you keep your airway open so you can go through your proper restorative stages of sleep with REM and deep sleep. And there's 3 things that need to happen with that. First, you have to have a big enough airway, because if you're breathing out of a coffee straw, you're kind of doomed no matter what, right? But I still have people who have a big garden hose of an airway that have severe sleep apnea. And that's because they can't maintain it, right? And so even if they have a big airway, if you don't have enough space for your tongue, or you don't have the musculature to keep that tongue out of the airway, you're still going to have collapse of that airway, and it's going to affect your ability to keep your airway open and sleep. And your body has to compensate and wake itself up in order to breathe. So, so we have to big enough airway, enough space for the tongue, and then you have to have the ability to keep that tongue out of the airway. So if you can't breathe through your nose, you're going to mouth breathe. If you have an undiagnosed tongue tie, it's going to pull that tongue down and back into the airway. And so that myofunctional therapy is going to strengthen those muscles to kind of deal with that musculature that has to be there to keep that tongue out of the airway. And so, with me seeing all these thousands of patients, I have some people that, like I said, have massive airways, have still a lot of space for the tongue, but they can't maintain it. And they have obstructive sleep apnea, which means there's still collapse. And that's all related down to the muscle function. So they don't have an option. Like if you do this, you're doing this. But granted, as you already know, the compliance is a big part of it.
Yes.
And so that's where, both with my expansion and my myofunctional therapy treatments, I have kind of a safety net, as you will, for those patients that aren't the most compliant, because those, this is non-surgical, so it requires an effort on both ends. And so but that's kind of what we're addressing.
Now, you said you have a safety net. What do you mean a safety net?
So I guess not a safety net, but so for example, some of my expansion appliances, they grow the midface. We grow the roof of the mouth, which is the floor of the nose, which improves the nasal flow. It decompresses the sinuses, so those can drain a lot better. We fix a lot of chronic sinusitis issues. This is all without going through the surgeries, right? All the ENT surgeries, and so that's my ideal appliance, but it's a bulkier appliance. And so you have this thing in your mouth, and you're trying to talk with this thing in your mouth, right? I was lucky enough that I was in the Army, and we know how efficient the military is with time. So I sat around with this expansion appliance all the time. I couldn't do that now, I don't think. But so some of my like salespeople, or people that are talking all day, every day, they're not going to wear this appliance enough to be able to get the success, right? I have a 75-year-old who wore that thing like 20 hours a day and was done in 3 months. I have a 20-year-old who wore this thing for like 3 years because he only wears it at night, right? So it's the wear time, not the age. That's the most important part. So if you don't have the wear time, that's where then I might, if I have somebody who actually has a decent nasal volume, they just need a bigger airway and more space for the tongue, I can do that with some with clear aligner therapy, and I can get some significant expansion with that, which is a lot easier to do. myofunctional therapy is you're doing these exercises 2 to 3 times a day, and so some people are more compliant than others. And so if I have a patient who is like severely like dysfunctional, where I've had like they've been in mile for like a year and a half, 2 years, because they have so many things they
Mhm.
have to work on, or the ones that just don't do it well, I'll use a device that's called Excite OSA, which is
Mhm.
kind of like a TENS unit for the tongue. It's not nearly as comprehensive as myofunctional therapy, just kind of like the clear liners aren't as comprehensive as the expansion appliance, but at
Right.
least it creates some kind of strength to kind of get that tongue up to the roof of the mouth. But if we're going to do any kind of tongue tie releases, that's still not going to be adequate. We still
Mm,
need, if they need to go through a release, they have to have formal myofunctional therapy
absolutely.
for us. But it is still a little bit of like, at least we can get something better than
Mhm.
nothing. But it's
Now, as
still,
far as far as releases go, are you in the mindset of release before expansion, after expansion? Just depends if the
great
appliance is
question.
fixed or not.
So, I mean, definitely, if I have a kid and they're in a fixed expansion, I want them to be done with expansion first before I go
Mhm.
through that, right? And so, I want to make sure, yeah, that I have a big enough garage first before I park the car inside of it, and because
Mhm.
as they've seen with some other studies, like I went through a lot of training with Dr. Zaghi, and I know
Mhm.
his stuff is always progressing and always is
Right.
and always developing, but it makes sense that if you give that tongue a lot more range of motion with nowhere for it to go as you do that release, only place it's going to go is back, and
Right.
you're going to make the sleep apnea worse. And so it has to
Right.
be sequential. You just can't go in there willy-nilly releasing everyone's tongue tie. And that's where the person who does all of my tongue tie releases, that's all she focuses on. But we're
Mhm.
very symbiotic that way, where she's seeing the kids, and that's a perfect time for them to do it without having to worry about
Mhm.
expansion. But then they look at the adults and they're like, oh yeah, well, the apple didn't fall far from the tree,
Right.
right? The
Right.
parents are like, well, okay, well, let's
Look at
do
my
it.
tongue.
Yeah, but first, yeah, we got to make sure we have
And
enough
I think
space
that's
for it.
why like tongue ties in some areas get a bad rep is because there are providers that are kind of willy-nilly just like releasing everything and not, first of all, prepping the patient, properly with myofunctional therapy, but not even that, that still doesn't just solve the problem, right? Like those patients, because they didn't have that tongue to palate contact or the pressures from the tongue resting up there, have those narrow arches. So they still have a narrow arch. They need expansion, or they're probably still going to, have some ongoing symptoms. And that's like my pet peeve. It's like, when we see our clients for myofunctional therapy, I'm like, look, I'm a piece of the puzzle. This is not a one-stop shop. I'm not the only person you're going to see. The answer is never just myofunctional therapy on its own, you know? And I think that there's some providers that don't emphasize the importance of that collaborative approach. And then there's families disappointed when they're not seeing the results that they wanted to see. And I
Mhm.
think that that's why, because I'm sure you've heard it where people say people are overdiagnosing tongue ties or it's a fad, it's not going to do anything. Um, yeah, so that's how I feel about that.
Yeah, totally. And vice versa too, right? You can't do expansion without myofunctional therapy, because that's the
Right.
reason why they happen in the first place. That's why you could do orthognathic surgery. I can do this crazy, facial like surgical thing, and everything relapses because you didn't fix the reason
Mhm.
why they needed that in the first place. But then vice versa, if you
Yeah.
have myofunctional, or I guess myodysfunction,
Yep.
then it's going to create the deformity of the bone. And so they kind of go hand in hand. And
Yes.
that's, I think, what's about this field is it's not there's really nothing in here where it's like one thing fixes it. It's
Right.
multifactorial, right? Even
Right.
even anatomically, when you like, that's why I say about the functional medicine people, I can fix an airway, I can fix the muscle dysfunction, but there's still a whole nother aspect of this that affects every other part of your body. And
Mhm.
but yes, sleep is the foundation to all the other things that they work on. So that's where very symbiotic is. They make my stuff more successful and I make their stuff more successful. But
Yep.
and then if you get into a more narrow vision in terms of what we're working for or working with, it's not just put jaw support in there, not just do mandibular advancement, not just do expansion, not just do
Right.
mono, not just do a tongue tie release. I mean, it's a combination of all those. And I even do, soft palate lasers where I can lift and tighten and shrink that up, which is a huge
Awesome.
thing too. So, I mean, there's, as you go into this field, you realize that it is a lot more gray. I can't just prep a crown and put
Yep.
that crown right on top of that margin. There's so much more to it than that.
Yep.
And it's a human body. So, yeah, I guess
Absolutely.
that's the complexities, I think, of this field is it is.
Definitely. Definitely. Now let me ask you this. Is there are there times where how do I want to phrase this question? Okay. Not every patient's going to accept treatment, right? Is there times where if a patient doesn't want to go through the expansion process, you'll do a mandibular advancement appliance for them to help with their sleep?
Yes, so that's what I did my residency in, were all those mandibular advancement devices. There's like 300 different versions of those out there. Um, and with adults, especially because anyone who has a CPAP, I mean, it's the few people that do well with it is great, but obviously
Mhm.
most people don't. And I kind of halfway joke that the way the CPAP fixes sleep apnea is it doesn't let you sleep. Um, and so, yeah, and then
That's
that's what a
funny.
lot of, a lot of these things do is they do. What's more important to me is your sleep staging and your sleep
Mhm.
quality. And so, just because we fix the apnea doesn't mean we fix the problem, because
Right.
your body isn't able to repair itself with REM and deep sleep in your brain and your body, because you're disrupting it with this mask on your face. And so most people are wanting an alternative. Not surprising, right? I mean, that was my option. Is they gave me this CPAP in the army and it told me to wear this octopus on my face, and I'm like, yeah, not happening. And so, but so as a result, because our goal is to optimize someone's sleep quality as quickly as possible. And
Mhm.
so it's going to take time to expand. It's going to take time to go through myofunctional therapy. So one of the things I incorporate with almost everything that I do in aligners, expander appliances, anything, is I'm having some form of jaw support.
Mhm.
Okay. Which, yeah, I like to call them mandibular support appliances, or like, rather than mandibular advancement. I don't like to advance. However, if your upper jaw is narrow and held back and your lower jaw is trying to fit into it, it's going to seem like it's advancement when you let that lower jaw go where it wants to be. Okay. But
Right.
I'm still usually like never going past edge to edge.
Mhm.
Okay. With my appliances, but I do incorporate that in pretty much everything that I do, especially if there's a sleep component associated with it. If my TMJ cases, I don't necessarily have to do that, but yes, as some kind of jaw support is a huge is what I try to do with a lot of, or most things that I'm dealing with. But it is still one piece of the puzzle. It's a lifetime thing. It
Mhm.
can have other little side effects. The problem with those appliances, though, is if your upper teeth are here and your lower teeth are here, and you're bringing that lower jaw forward, where now they can breathe better and sleep better, okay, then that's where these muscles are actually going to be like, oh, I like this position, and they start to relax. And so
Mhm.
now you start to relax in this position. And if you have a deep bite where your upper teeth are covering a lot of the lower ones, now all of a sudden your jaw's resting in this position. You wake up in the morning and you're like, oh, how am I supposed to chew? Right. And
Right.
so it's because the upper teeth are in the way. And so we want to make sure that that's when I have to tell people that if we're going to do that, there's going to be a higher chance, especially based upon the presentations that they have, that they're going to have some other side effects. And so
Right.
that's what we guys go through clear liners. And then also the limitation of those appliances, that they're only maintaining the airway that you do have. They're not really making the airway bigger. And
Right.
so
Right.
you kind of have to, and I mean, I had one yesterday that actually qualified for it. I maybe get one a month out of like the 100 plus patients I see each month, but ideally you have to have a big enough airway. I don't want much of an overjet at all. So when I do bring you forward, I'm not creating much of an interference, and we're not going to create that bite discrepancy. So when we do those by themselves and just start with that, I want to make sure that they actually have a decent airway to breathe out of,
Right.
at least behind there, and ideally, hopefully, don't have too much of a deep bite, because that's when you can start to mess with the bite or discrepancies, and then I need to fix those with clear liners, and do some expansion, essentially,
Right.
because upper teeth
Now,
and the upper jaw's in the way.
for your patients with uh TMD,
Mm.
are you going right to an expander? Do you put them in an orthotic first? Does it depend?
Yeah, there's so many different ways that people go about this, right? And so my partners and I, we were trained with Steve Olmos, who's another kind of guy that's in TMD realm and sleep
Mhm.
realm, and I mean, they give you this big old like mini residency book that's like bigger than my head, and you don't need to really go through it. It's quite honestly, it's a lot more simplistic than we kind of make it out to be.
Uh-huh.
When it comes to TMD, when you're looking at, like, you have some of the neuromuscular docs out there, and I know they do some amazing stuff, but
Right.
never had to do that to get my results. And so, yes, splints, it's kind of just like a mandibular advancement device. It's just
Mhm.
in the jaw, the lower jaw, where it's supposed to
Really.
be. But we've been treating the wrong jaw this whole time. It's the maxilla, the upper jaw, that needs
Right.
to be fixed, that needs to be expanded. So just from expanding out, either via clear aligners to get those front teeth and those upper jaw teeth out of the way. It allows that mandible to come forward. I mean, I do that with all my TMD patients, and we have massive amounts of improvement, if not complete improvement. I mean, I had a patient who had Invisalign, and I'm not to like bag on them, but most Invisalign, if you just accept their proposal that they give you, it's going to be retractive. That's why they have buttons and IPR. And so we don't want to do that. And so she had Invisalign and full mouth rehab, and then she has all this facial pain, severe facial pain, tongue issues. It's like now her tongue is like getting irritated, and she like is debilitated for like 9 months. And I put her in my expansion-based aligners, and she said it was like in a week and a half, her pain has been completely gone. And I've continued to do that. And she's 75 years old. So it's not like she's like this young buck who should be able to bounce back like that.
Right.
Other people that I just do expansion with these clear aligners and do it in a certain way. People are doing Botox injections every quarter to try to fix their headache problems, and they don't have to do those anymore. So I don't typically have to splint for our TMD patients to fix them. Just from a little bit of expansion, they start to get some improvement, and that positive snowball effect happens really fast. So I don't feel like I need to do some splinting. I don't feel like I need to do neuromuscular stuff. I do have a special laser that can actually do what we call photobiomodulation on the muscles to help get those kind of relax a little bit. And that helps a lot with the very acute stuff. Like right off the bat, but I don't have to do that for very long before the expansion starts to really improve their symptoms.
Now, just out of curiosity, what was your transverse measurement before you put yourself through expansion and after?
So I wasn't that far off when you look at like a typical person. I was like 36, 37. Okay. And so I still need more. So actually, I'm going through my trays myself. I just took them out for this podcast. But it's been like 6 years since I finished my expansion case. And so I actually had a unilateral crossbite that my orthodontist left me in, right? And I'm like,
beautiful.
Once I go to dental school, I'm like, oh, this isn't normal. Okay, weird, right? And so I actually, when I went through my expansion appliance, I had such a significant unilateral crossbite that when I maxed it out, I was like edge to edge, and I was like destroying my cheek. But I was still feeling so much better that I was kind of like, yeah, I'm done wearing this thing. I had appliance fatigue. I let it kind of relapse back down. And now just because perfectionistic kind of tendencies, I'm jumping that crossbite. So I went from like 36, 37 to around 40, but also, I mean, I'm like half Caucasian, half Islander. And, Caucasians are going to be a little bit more narrow than even like Hispanics and Africans and Asians. They have a shorter cranial base, and they need even to be wider, like 45 millimeters or more. So, but yeah, anyways, yeah. And the cool thing about these expansion appliances is that I'm not just moving the teeth. A lot of it is actually going into the bone. And so I'm expanding out the roof of the mouth. That's the expansion that I'm getting, even more important than the transverse width. Clear aligners give me a lot more of the transverse width than I can even get with the expanders, but they don't improve nasal volume and sinus flow, which is a huge part of this whole process.
Now let's talk a little bit about tooth pillow, because I'm very excited to bring this to my audience and even our students in our myo courses, because, a lot of the students in our myo courses, they're like, okay, I want to do this, but there's no providers. Like, who am I going to send my patients to that these kids need, they need help. There's nobody around me. So if you want to talk a little bit about tooth pillow, I don't know. We have not talked about it yet on the podcast. So
okay,
it could
great.
be good.
Our first introduction to tooth pillow. I'm so excited about this product because I've kind of built my name off of treating adults, and I've treated, thousands of adults. A lot of these techniques I've done the most out of the companies, from both like Candid aligners and Vivos appliances. And so I've done thousands of these cases. And so I built my name on my adult cases. But not surprisingly, I've done a lot of kids too. But because of everything I've seen with these adults, it really, like, people have suffered for decades, right? And it's pretty often that I'm seeing a father and a son come in. Like, so this is actually one of the things that initially kind of like, oh yeah, this is crazy, because I see this kid and the dad comes in too, and I'm starting to talk about all these things, how all these things are connected. His bedwetting issues, ADHD problems, all these things that this kid's dealing with, and the dad's like, he is exactly who I was as a child, and he's now 40 years older though, and so you just see what his life's gone through, and he's like, if I can prevent that, like, like, holy smokes. And so obviously then they both go into treatment, but his son, he stops wetting the bed after 2.5 weeks. His ADHD is like those symptoms are drastically reduced, and his performance in school. I mean, it was like the teachers are like, what happened like recently? And so, it's funny because then that dad refers like all 8 of his siblings to me. They like a couple of them are from out of state and they even still come to
Yep.
see me. And then mom and all of her friends like
Yep.
bring in their kids and then their dads. And so like this one kid that I fixed pretty quickly, all of a sudden turned into like 100 people. And
Yep.
so when you look at this problem that we have, this pandemic in Western society that we've created with these muscle dysfunction and these small jaws, even if I saw 1,000 kids a month, I wouldn't touch the surface of the amount of kids that need to be treated. And so
Right.
tooth pillow is essentially, yes, it's going to be a kind of a myofunctional therapy appliance that we can get more preventatively with these kids from 3 to even up to 12 to get the muscles working like they're supposed to, get some jaw support, get their airway open, get them breathing through their nose with their mouth closed and their tongue up against the roof of the mouth, and getting a proper swallow so that tongue can do what it's supposed to do every time you swallow.
Mm.
And so, can people go from like all the way to possibly not needing braces with these appliances? Yes, but not everyone's going to be doing that. Maybe still some people need some adjunctive therapies with some fixed expanders, but this is a great, like, quite honestly, I feel like this should be evaluated with every kid. And, we should be getting these kids because who knows? I mean, when's the last person that you met that breastfed their kid 3 to 5 years like they're supposed to? Right. I mean, they have baby-led weaning stuff. I mean, my wife she's a saint, and she breastfed our kids for 3.5 years. And it's actually interesting, a little side note, but I have my own case study where one was released at birth and one wasn't. And they both were breastfed. They both were baby-led weaning, and they have 2 completely different presentations. So I'll get into that here in a second. But
Yeah.
Yeah, I never thought I could be on what I could feel like the brink of a revolution with society as a dentist. And what we can do with tooth pillow and these appliances that a kid wears pretty much at night and maybe an hour or 2 during the daytime can get drastic improvement with them, to where even if they need something else down the road, say they need to still finish with like a clear aligner or something at the end, they're almost already there. So you're not going to be doing these 2 to 2.5, 3, 7 years of ortho, but not only that, we're actually fixing the muscle dysfunction that like isn't fixed with ortho anyways. And so these appliances are not only going to be improving their ability to sleep right off the bat, because there's some jaw support, and then getting the muscles to work like they're supposed to, start to guide those teeth where they need to be, get like that going. So a tooth pillow appliance is, you have this series of doctors, because there's not a lot of towns that have people like me and other Dr. Hale, Dr. Moralia, all these other doctors that are airway focused. Thankfully, it's becoming more of a known thing, but you got to get the experienced people, and access to care is difficult. And so this is a way that we can treat these kids virtually and get them going down the right path, and at least get them, like with kids, I say that like they're going down the tracks. We're just helping turn the train in the right direction. Whereas adults, the train's completely off the track. I got to put it back on, and they're steering it that way. So, we can do this virtually while you're still under the care of a trained airway dentist that knows what they're doing, and getting you through that process. At least you go down that right path. And yes, people are going to run into some troubleshooting stuff. Some kids are great with it. Some kids need a little bit more TLC, but that's why we start a huge support system to help these kids along, to at least get them in the right direction. But I think this could be revolutionary, quite honestly, for society. I mean, there's a book called Why We Sleep from Matthew Walker, that we know that there's not a single part of the brain or the body that isn't negatively affected from poor sleep quality. And the child is not immune to that. I mean, like, none of us are our best selves when we don't sleep well. And if we can start this process early, and then this is more preventative medicine, which is people are wanting now. We don't there's a reason why like functional medicine is becoming such a bigger thing too, is because everyone's just being thrown pills, and they're realizing this isn't it. And kids with ADHD like being put on these amphetamines, these like to try to fix it, and
They're only gonna hinder their sleep more.
Correct, exactly. And so most kids have this problem. Most kids are underdeveloped. Most kids aren't functioning properly. Most kids are not breathing properly. When you see them moving around like crazy all night long, when they're mouth breathing, when they're snoring, when they wake up with bags under their eyes, when they have the grinding and the acid reflux that people don't even realize, and they see their teeth flattened out, and they don't have spacing between all their baby teeth. These are all things that need to happen. And I mean, it's a unicorn. Like if what I'm looking for, pretty much anyone who's listening to this podcast, I guarantee your kids don't fit those criteria. I think I've
Right.
seen one in 6 years. And
Right. Yeah, they're unicorns.
yeah, it is exactly what that is. And so, this is a way to start getting them in the right direction that not just only helps them right now with their ability to learn, their ability to cope, like mental, emotional, physical health is all related to this. And if we can get them going down that right path, I mean, what parent is not going to sign that up for their kid to be able to improve them, at least getting them in the right direction for that? And this is a way to at least get that ball rolling in a positive direction. Could there still be more adjunctive therapies down the road that are needed? Yes, but it's going to be a lot less needed when we start to go through this. And that's what our tooth pillow, I guess, mission is to, improve these kids' quality of lives and their life moving forward that they wouldn't even realize would be such a drastic difference if we can't get them on this right path early on. So,
Absolutely. And everybody stay tuned because we're definitely going to have an episode coming up soon that is solely just focused on tooth pillow. But Dr. Goles, thank you so, so much for taking the time to chat with me. This was an amazing episode. I'm excited to get it out. So thank you for taking the time.
yeah,
And
thanks
then
for
we'll
having me.
have you back on again to talk more about tooth pillow.
Sounds great. Thank you so much, Brittany.